Welcome to episode of Neurodegeneration Awareness and AI, where we explore the intersection of technology and neuroscience. I am your host Aditya, and today we have a special guest, Dr. Kaneez Fatima. She is a distinguished pharmacologist and associate professor from India, also a research fellow in Malaysia with over a decade of experience in pharmacology, uh, phytoconstituent based drug development, nanotechnology, and systematic reviews. Dr. Kaneez, welcome to the show.
Thank you, Aditya. I'm excited to be here.
So, today we are going to be diving into how AI can significantly contribute to neurodegeneration awareness. Dr. Kaneez, let's start with educational campaigns. How can AI help in this area?
AI offers a remarkable capacity to transform educational campaigns by moving beyond generic outreach. It can create personalized educational content tailored precisely to different audiences, ensuring that the information is relevant and impactful for each recipient. This capability extends to interactive websites, chatbots designed to answer specific questions about neurodegenerative diseases, and sophisticated AI-driven social media campaigns. And these campaigns can target specific demographics with message crafted to resonate with their unique needs and concern. The underlying benefit here is a shift from a mass communication to precision outreach. So this approach allows for a more efficient and effective use of awareness resources by identifying and addressing specific knowledge gaps and communication preferences within diverse population. So ultimately leading to higher engagement and better retention of vital information.
AI has been used in education since a while now, and I think it's about time we also start using it for spreading the awareness. And it was very fascinating what you said. Now, what about early detection and diagnosis? How can AI play a role in this area as well?
See, AI plays a pivotal role in early detection and diagnosis. AI algorithm possesses the ability to analyze a vast amount of complex medical data, such as MRI scans, and to detect subtle early signs of diseases like Alzheimer's, Parkinson's, and ALS. And this capability is crucial because early detection directly translates to earlier intervention, which is fundamental for more effective disease management. This represents a fundamental shift in diagnostic paradigm. Traditionally, diagnosis often occurred reactively based on manifestation of clear symptoms. However, AI enables a proactive preclinical detection, opening a critical window for therapeutic intervention that can be potentially slow or even prevent disease progression rather than merely managing advanced symptoms.
Absolutely, Dr. Kanis. So after early diagnosis and detection, what about predicting? What about predictive analysis? How can AI help identify risk factors?
Predictive analytics takes the proactive approach a step further. AI can analyze large data sets to identify integrate risk factors and predict which individual might be at higher risk of developing neurodegenerative diseases. And this information is invaluable because it can be strategically used to raise awareness specifically among these high risk groups. This capability extends beyond just early diagnosis it as it enables pre-diagnosis intervention and education. And by identifying individuals at elevated risk, resources can be strategically allocated to the most vulnerable population, potentially facilitating lifestyle modification or very early screening that could delay or prevent disease onset altogether. So, this proactive public health model has the potential to significantly reduce the overall disease burden.
That is very crucial for prevention. Now let's switch gears and talk about virtual assistants. What do you have to say about how can these virtual assistants help in assisting patients?
AI-powered virtual assistants can provide invaluable daily support to patients. It can offer reminders for medication, appointments, and daily tasks, thereby helping patients manage their condition more effectively. The direct benefit here is that these assistants empower patients with greater autonomy in their daily lives. They also significantly reduce the cognitive loads on both patient and their caregivers, fostering better adherence to treatment plans and ultimately enhancing the overall quality of life.
Aside from patients, there are also support groups and communities that are also dealing with these problems. How can AI facilitate this group of people?
Yeah. AI can be instrumental in facilitating online support groups and community where patients and caregivers can share their experiences, seek advice, and find emotional support. So, the ability of AI to create and manage these virtual spaces addresses a significant challenge, that is, overcoming geographical barriers and the persistent stigma often associated with neurodegenerative diseases. Also, by enabling the sharing of experiences and providing emotional support, AI fosters a sense of community that might otherwise be difficult to achieve. This also means AI can actively combat the isolation commonly experienced by patients and caregivers, establishing scalable, accessible, and inclusive platforms for connection, which in turn enhances mental well being and builds collective resilience.
That is very fascinating. What about research and development? How does AI accelerate the process of research and development?
AI acts as a powerful accelerator in research and development as it can analyze a vast amount of data to identify patterns and potential treatments that would be imperceptible or too time consuming for human researchers alone. This leads to new insights and breakthroughs in understanding and treating neurodegenerative diseases. This also highlights AI's foundational role in scientific discovery, moving beyond mere data processing to sophisticated pattern identification. The consequence is a significantly faster pace of drug discovery, more precise biomarker identification, and a deeper understanding of disease mechanism. So all this ultimately translates to better diagnostic tools and more effective therapies for patients, and ultimately which amplifies awareness by showcasing tangible progress in the fight against these conditions.
I think that's going to significantly increase the efficiency of doing research and development.
Yeah, yes.
And let's talk about public health monitoring. Is there any way that AI can make a difference in this area?
AI can monitor extensive public health data to track the prevalence and impact of neurodegenerative diseases. This capability is vital for helping policymakers allocate resources more effectively. This also demonstrates AI's utility beyond individual patient care, extending to systemic public health management. So, the broader implication is that AI enables data driven policymaking, ensuring that limited resources are directed to the area of greatest need. And this maximizes the societal impact of awareness and intervention program and fosters a more equitable distribution of care across populations.
That was very fascinating. What do you think about personalized treatment plans, which are becoming more and more important nowadays? How does AI contribute to them?
AI significantly contributes to personalized treatment plans by analyzing individual patient data. which includes genetic information, lifestyle factors, and detailed medical history. And based on this comprehensive analysis, AI can create a customized care strategies. So this approach moved beyond standardized protocol to bespoke care, acknowledging the inherent heterogeneity of neurodegenerative diseases. The broader implication is shift toward true precision medicine, where treatments are optimized for each patient's unique biological and lifestyle profile. This leads to improved efficacy, reduced side effects, and an enhanced quality of life. Furthermore, it significantly enhances awareness by demonstrating the sophisticated, tailored care now possible through advanced technology.
A part of personalization is language and speech. So, can AI assist in language and speech therapy?
Definitely. AI-driven tools can provide invaluable assistance in language and speech therapy, directly helping patients maintain crucial communication skills. This addresses a profound challenge often faced by individuals with neurodegenerative diseases, such as the progressive loss of ability to communicate, which can be deeply isolating. The ability of AI to support communication preservation means it can uphold the patient dignity and significantly improve their quality of life by enabling continued social interaction and expression. This fosters a sense of connection and reduces the emotional burden on both patients and their families.
Finally, caregiver support is also essential. How can AI provide resources and support for caregivers?
See, caregivers play an absolutely critical, yet often overlooked role in managing neurodegenerative diseases. Here, AI can offer comprehensive support through training programs, stress management tools, and real time advice, making their demanding role considerably easier. The provision of these resources by AI contributes to a more holistic care ecosystem as it recognizes the supporting caregiver is integral to the patient well being and the sustainability of the care. So, by mitigating caregiver burnout and enhancing their capabilities, AI ensure more consistent and higher quality care for patients while simultaneously raising public awareness of the significant demand placed on caregivers and importance of supporting them.
Dr. Kaneez, thank you for sharing this insight. It's clear that AI has immense potential in raising awareness, improving diagnosis and treatment, and also enhancing the quality of life for those affected by neurodegenerative diseases.
Absolutely, Aditya. It's an exciting time for both AI and neuroscience.
That's all for today's episode. Thank you for listening and join us next time as we continue to explore the fascinating world of neurodegeneration and AI. Thank you.